Dr. Josh Dahl, and I'm an interventional cardiologist with the Greenville Hospital System. Hypertrophic cardiomyopathy is a disease of the heart muscle that affects less than 1% of the population. It's a disease that's genetic in that it can be inherited. The resulting problem is thickening of the heart muscle that leads to myocardial dysfunction or heart dysfunction that often manifests as heart failure or arrhythmias. There are specific subtypes, and the most common we run into is a type where specific areas of the heart muscle are thickened, creating blockage of blood flow out of the heart. This leads to problems of heart failure again, but also can lead to drops in blood pressure and passing out spells. These are the most common problems that people with HCM or hypertrophic cardiomyopathy encounter. The symptoms they generally have are shortness of breath. They can have chest pain from poor blood flow to the heart muscle because of this thickening. And then they can have symptoms related to the arrhythmias, such as fast heart rates and passing out. The principal treatment for hypertrophic cardiomyopathy is medicine. There are medicines aimed at improving the function of the heart muscle and limiting the amount of heart failure, as well as limiting obstruction of the blood flow out of the heart when that specific type is involved. Most people do very well with medical therapy, and we can control their symptoms with medicines. There are people who unfortunately do not respond to the medicines, and more invasive therapies need to be sought. So if medical therapy fails in treating the obstructive symptoms of hypertrophic cardiomyopathy, that being the heart failure and passing out spells, invasive therapies can be sought. The traditional therapy is open heart surgery to reduce the thickness of the heart muscle, and where heart muscle is actually removed from the heart to allow better flow of blood out of the heart. Over recent years, in the last 10 to 15 years, a procedure has been developed that we perform here called alcohol septal ablation, which is a procedure performed through a heart catheter, much like traditional heart catheterization. And in this procedure, we can access an artery that specifically supplies the troubled area of the heart muscle and direct a therapy which causes scarring of this area and subsequently shrinking, which allows better flow of blood out of the heart. After alcohol septal ablation, generally the full scarring of the area of interest takes up to 3 months to complete. Symptoms are often relieved immediately, but can take a little time to see the full benefit as that area of muscle shrinks. But most patients do in fact feel better quite rapidly. The procedure is successful roughly 85% of the time. There are a small segment of patients who need to undergo a second procedure, and rarely there are patients who do not respond to the procedure. At Greenville Hospital System, we have physicians and staff that are experienced with the procedure. They're not only experienced with diagnosing the problem, but evaluating it and completely evaluating it, and all the other issues that come along with it, including the heart failure issues as well as arrhythmias, and counseling you as to what you need to do for your family, since it is a genetic disorder. We are experienced in the procedure, as I said, and the nursing staff and ancillary staff are very experienced with the patients afterwards. So I trained at Medical University of South Carolina under Bill Spencer, where I learned how to do alcohol septal ablation. And Bill Spencer is the physician who first brought alcohol septal ablation to the United States when he was in Houston, and then came to Charleston, and that's where I was able to train and learn how to do the procedure. Currently in the upstate, I'm the only physician performing alcohol septal ablation. We perform this procedure at Greenville Memorial Hospital, where we've been able to train staff to understand how to treat the problem both before and after the procedure, and how to respond to issues involved with the procedure. I think it's important to have a staff that's well trained and focused in this area, as it's not a common procedure done, and they have to understand what the problems are and how to respond. The age of onset for hypertrophic cardiomyopathy is quite variable. Can begin in childhood and can be as old as into the 80s. Even though it's a genetic disorder, the onset of heart muscle thickening and then subsequently symptom onset can be quite variable.